Okay. My screen is visible to you now.
Yes, ma'am, it's visible.
Okay, okay, fine. So structured discussion, when you enter into the cubicle, outside the cubicle, there is written task. You have to read the task in 2 minutes, compile yourself, make a brief key, what you have to talk inside, right? In 2 minutes. So you have to do the practice in the, every task. 2 मिनट में ये टास्क पूरा कर रही हूँ या नहीं कर रही हूँ, right? Once you enter into the cubicle, the same task displayed in the table. वहां पे एग्जामिनर होगा, लेमेन एग्जामिनर नहीं होगा, वहां पे रियल एग्जामिनर होगा आपके साथ. हो सकता है एक ऑब्जर्वर भी हो और एक दो एग्जामिनर्स भी हो. यू हैव टू interact directly with the examiner in the structured discussions. So once you have to enter into the cubicle, you have to greeting with your examiner and ask permission to sit down. Examiner आपको खुद भी बोल देगा कि have a seat please, right? सलाम करना है, बैठने की परमिशन लेनी है, or says that the examiner is asking, are you ready for? So you says yes. So introduce yourself. I'm Dr. Meena. I'm Dr. Shabnam, one of the MRCOG candidate or one of the FCPS 2 candidate. My candidate number or my seat number is this. I have read the task, clinical scenario. I'm ready for structured discussion, right? Then examiner will ask you the series of the questions like a viva. You have to introduce yourself. I'm Dr. Shabnam, one of the FCPS 2 candidate. My candidate number is this, or 1, 2, 3, 4, whatever your number. I have read the scenario and I'm ready for question and answer session or structured discussion. Right? Okay. So Rima, this is your task. Read it in 2 minutes. Your time is over, Rima. Rima, your 2 minute is over. Hello.
Ye-
Hello.
yes, ma'am.
Your 2 minutes are over. You are ready?
Yes, ma'am.
Okay. So shall I start?
Yes, ma'am.
Okay. So have you read the scenario?
Yes, ma'am.
Scenario number one. Tell me what would you check and discuss with her on your pre-operative ward round?
Should I start?
Yeah. Your time is
Uh,
running.
Assalamualaikum. I am Dr. Rima. I am FCPS 2 candidate, and I have read the scenario, and I am ready to for the discussion. So,
I'm Dr. Rima, FCPS 2 candidate. My seat number is or my roll number is. ठीक है?
yes, ma'am.
Okay. So tell me what would you check and discuss with her on your pre-operative ward round? You have
Sorry, ma'am.
45. My question is that in case number one,
Yes, ma'am.
Mrs. A is 45-year-old school teacher with troublesome menorrhagia. She has been attending gynae clinic with this over the last 18 months. Her symptoms have not been satisfactorily relieved by a sequence of medical treatment. She wants a hysterectomy and has been admitted to hospital for tomorrow morning operating list. ठीक है? Clear?
Yes, ma'am.
Tell me what would you check and discuss with her on your pre-operative ward round?
First of all, I will introduce myself to the patient, and then I will confirm the identity of the patient by asking the name, and then I will confirm the procedure which is going to be done. And after it, I will confirm the consent is it taken, well informed written consent is there, and then I will look for the investigation, especially the hemoglobin, and other investigations are complete, and then I will make sure that the blood is arranged, and it is a cross match, and donors are ready in the case more blood is in need during the operation, and I will confirm the anesthetics evaluation has been done, and after it I will ask I will look for the any comorbidities just like the hypertension, diabetes, and if they are either controlled or not, and the previous surgery, surgical history, and any drug allergy. I will reconfirm any drug allergy from the patient and the addiction, and I will look for the BMI of the patient, and then I will advise the patient to keep NPO from the midnight 12 a.m. and then she has to take shower early in morning, and then she will be shifted in the operation theater. In the end, I will ask about the concern of the patient if she has any.
Okay, okay. So you almost cover most of the points, but in the brief, in the few lines, review her clinical record,
Mhm.
including any previous surgeries, right?
Yes, ma'am.
सर्जरी इसलिए पूछ रहे हैं कि वो प्रॉब्लम करेगी इन द करंट प्रेगनेंसी इफ शी हैड प्रीवियस सर्जरीज देयर मे बी एडिशंस ठीक है ask about current menstrual problem inquire about other symptoms or health problem shake her understanding of intended operation जो आपने बता दिया ठीक है कि कंसेंट ली हुई है साइन है पेशेंट इंफॉर्मेशन लीफलेट उसको मिला है या नहीं मिला है चेकर लॉस मेंस्ट्रुअल पीरियड contraceptive use or possibility of the pregnancy test and other investigation you have to look for cervical smear discuss the route of hysterectomy laparoscopic होगी abdominal होगी vaginal होगी previous surgeries to anticipate the difficulties, current medications, might be she's taking the insulin or warfarin or she's taking Clexin, so which may be switch bridging thromboprophylaxis or antiplatelets agents which may be stopped. Ask for allergies, some antibiotic, prophylactic antibiotic has been given for the surgery, so might be she is allergic, any previous biopsies, right? अगर उसकी previous biopsy में कैंसर है उसका और एटिपिकल एंडोमेट्रियल हाइपरप्लेजिया है, तो आपने फिर उस हिसाब से उसकी हिस्टेक्टोमी करनी है। अगर कैंसर आ गया है तो वर्दीम हिस्टेक्टोमी या एक्सटेंडेड हिस्टेक्टोमी और lymph nodes, you have to ask for previous biopsy too, right? Anesthetic review, right? आपने वो बता दिया था. Most of the point you have covered, but few points you have missed. You have to cover in the next session or do your practice to keep all these points for your exam. Okay, so next question is, would you undertake pelvic examination on her now?
मैम इट विल डिपेंड।
हेलो मैम, वॉइस नहीं आ रहा है।
वॉइस नहीं आ रहा? रीमा को तो आ रहा है।
यस मैम, मुझे क्लियर है मैम। इट डिपेंड्स।
इसको वॉइस नहीं आ रहा है, अपना माइक चेक कर ले प्लीज, क्योंकि कैंडिडेट को आ रहा है, इसका मतलब है कि मेरी तरफ से कोई प्रॉब्लम नहीं है। ओके, रीमा, would you undertake pelvic examination on her now? If yes, then why? If no, then why? ठीक है
मैम, I will undertake to confirm my findings, to know to confirm my finding before the procedure.
Okay, mean you have to do it, right?
Yes ma'am.
Okay, ठीक है. So if you don't want to do it, then suppose मैं बोल रही हूँ नहीं करना चाहिए, क्यों नहीं करना चाहिए?
Then after consent I will not do it. I will do it in OT under anesthesia before operation.
Okay, but why? To confirm your findings?
Ma'am, to confirm the findings before the surgery, at which side the mass, if she is having mass, there is no any mass, then to look for the site and size to confirm it. Either I'm going to perform the major surgery, so I must be we must be reassured before the major operation.
Okay, suppose I'm saying कि नहीं करना चाहिए, तो क्यों नहीं करना चाहिए? आप बोल रहे हो
the reason could be because before the surgery we will perform it under anesthesia through bimanual and through the abdominal. That's why we can sometimes miss.
Okay, so the answer is that yes, मैं करूँगी. Why? Because to check the current uterine size, extent of the prolapse, might be इसको prolapse हो, check significant cystocele or ectocele, check the mobility of the uterus, mobile है नहीं mobile है, to decide if vaginal approach is appropriate. Okay, अगर आप बोल रहे हो कि नहीं मैं नहीं करूंगी, you have to justify it. Yes वाला भी जस्टिफाइड करें, नहीं वाला भी जस्टिफाइड करें. अगर एग्जामिनर आपको वहीं पे अटका देता है कि नहीं करना चाहिए, ओके ठीक है, तो आपको वो भी जस्टिफाइड करना चाहिए. अगर मैं नहीं करूंगी तो क्यों नहीं करूंगी? असेसमेंट विल बी मोर अंडर एनेस्थीसिया इन द थिएटर, तो अभी मैं नहीं करूंगी, ठीक है. I'll do it under anesthesia because the patient is totally relaxed and it would be more easy and findings are more appropriate. So patient should be prepared for the route of hysterectomy. अच्छा नहीं करूंगी क्योंकि इसका रिसेंटली ओपीडी में असेसमेंट तो हुई है, असेसमेंट के बाद ही तो ये एडमिट हुई है, तो मैं दोबारा से क्यों करूं? क्लियर कैंडिडेट, जो अच्छा कैंडिडेट होता है वो घुमा देता है, मैडम ये करके ही तो आई है ओपीडी से, वहां पे मेरे कंसल्टेंट ने देखा है, मैं क्यों करूं? क्लियर फाइंडिंग लिखी हुई है उसकी, ठीक है. एक जस्टिफिकेशन तो यही है. दूसरी जस्टिफिकेशन है कि आई वुड नॉट डू नाउ बिकॉज पेशेंट इज नॉट रिलैक्स और फाइंडिंग्स आर इनएप्रोप्रिएट. पर vaginal examination might be uncomfortable for the patient in the ward, so I will do it under general anesthesia before doing the procedures, right?
Okay,
अगर मैं करूंगी तो चेक द करंट यूट्राइन साइज. अच्छा वो तो मेरे कंसल्टेंट ने किया था ना, तो दूसरी डॉक्टर ने किया था, मैंने तो नहीं किया था. सर्जरी तो मुझे करनी है, सो आई वांट टू डू माय असेसमेंट बाय माय सेल्फ. चेक करंट यूट्राइन साइज, extent of the prolapse, अगर सिस्टोसील है, रेक्टोसील है, मोबाइल है यूट्रस, नहीं मोबाइल है, वजाइनली आएगा नहीं आएगा, डिसाइड इट. ठीक है?
Okay, ma'am.
Next question is, there is no significant prolapse. ठीक है, एग्जामिनेशन किया, there is no significant prolapse in the Mrs. A case, and you decide to undertake the hysterectomy by abdominal route.
Okay,
How
ma'am.
would you decide whether to undertake a total or subtotal hysterectomy? कैसे डिसाइड करोगे, इसमें टोटल करूँ या सब टोटल करूँ?
It depends on the patient history, and if there is a past history of any abnormal cervical smears, and if there is a and the patient wishes, and ma'am, it depends. And it also depends upon the past surgical history. If there is a past surgery, so it will be the due to the adhesion, it will be the difficult for me for the complete hysterectomy, so I can leave it. So in case when there is a no any previous history of the any cervical smear, any abnormality in cervical smear, or any past any history for family history of the cancer in this case.
Family history of cancer of cervix?
Ma'am, no, but if there is abnormal smear.
Where is the matter? तो abnormal smear families में run होता है?
No, ma'am. No.
Why you worried about family history?
No, ma'am, I will not ask in this case.
Okay, so clear. It's a simple. That depend upon the patient wishes, the patient preference at a glance, and I would explain her the pros and cons. If the patient is willing for subtotal, okay, good, we have to go. Let's also depend upon her history, cervical smear history. If the abnormal cervix or abnormal smear, then you have to remove it. We have to go for total hysterectomy. But if the patient smear is normal and she is willing to continue for the cervical smear screening, you have to go for subtotal hysterectomy. Sometimes the surgery is difficult, there is adhesion of the previous surgeries, obese patient, deep pelvis. In these cases, the surgery is difficult, and you have to go for subtotal hysterectomy. But if the thin lean patient है, previous surgeries नहीं है, कोई adhesion नहीं है और cervix आ जाएगा, तो easily you have to go for total abdominal hysterectomy. So that's depend upon the patient's cervical history, her wishes, her weight, the BMI, her previous surgeries, and her compliance, whether she is willing to continue for cervical screening if we left the cervix. And subtotal hysterectomy is easy if there is a bigger uterus, तो आराम से हो जाएगी. ठीक? So you
Okay,
have to
ma'am.
put these points in your mind. Okay, your fourth question is, what issues will you discuss to help Mrs. A in decision if she wishes to have her ovaries removed or not? उसे क्या डिस्कस करनी है कि ओवरी निकालें नहीं निकालें?
Ma'am, she's a patient with 42 years, I guess. She's a patient with 45 years. She is perimenopausal. I will discuss the pros and cons. If I will ask about the family history of the cancer of the breast, colon, ovarian, and the endometrial. If there is a no any history and an ultrasound, there's a no any mass in the ovary and no any intraoperative finding, then I will not remove it, because there are the disadvantage in removing the ovary in this age. So because post-operative, after removing, she may need the HRT, hormone replacement therapy. So I will discuss the both the things, the pros and cons of this removing the ovaries. If there is a no any risk, then I will not recommend to remove the ovaries.
Okay, very good. So she's 45 years, she's perimenopausal. We have to discuss with her the pros and cons and keep the factors in your mind, whether she has an history of the premenstrual syndrome, right? She has a family history of ovarian cancer. उसमें आपने remove करनी है, ठीक है? And if we remove the ovaries, she immediately developed the menopause. She required hormone replacement therapy for time of menopause. 52 years तक वो लेती रहेगी, even more than that. If ovary is concerned, the future ovarian cancer, there is risk of ovarian cancer. 1.4% तो है ना जनरल population में. If ovary is concerned, could have future diagnostic difficulties if she is an ovarian cyst because of the adhesions. If ovary is concerned, risk of trapped ovary syndrome, dyspareunia. If ovaries required removal later on in life due to any problem, subsequent surgery will be more difficult. So these are the cons of the removal of the ovaries. ठीक, ये problem हो सकती है. Okay, what practical issues would you want her to expect during immediate post-operative period?
Ma'am, during immediate post-operative period, she may experience the small vaginal bleeding. She may experience the pain, and the ma'am, immediate post-operative.
हाँ, practical issues क्या होंगे उसको?
Ma'am, pain, bleeding,
Okay.
And difficulty in mobilization due to the pain and due to the major surgery, and there may be the risk of the urinary tract infection because of the Foley's, and later on there may be the risk of the wound infection, and there may be the by keeping her BMI in view, there may be the risk of the venous thromboembolism, paralytic ileus, and these are the some of the risks she may face in the post-operative period.
Right, Rima, but you have to add few points more. In the post-operative period, she needs the IV fluids.
Yes, ma'am.
वो भी तो उसको issue करनी है ना, oral तो नहीं लेगी ना.
Antibiotics or in
also, and she might have a wound drain. वो भी उसके लिए problem होगा कि नलकी क्यों चढ़ी हुई है. Catheter drainage. This is also the problem for her. This is a practical issue, not problem, but this is a practical issue she might face post-operatively. Drain होगा, catheter होगा, दर्द हो रहा है, दवाइयाँ खानी है, mobilize नहीं कर सकती, physiotherapy की need होगी, some vaginal bleeding है, ठीक है? So these are the problems or issues, the practical issues. You have to counsel her immediately in the postpartum period. वो आपको उसको बताने हैं कि ये problems होंगे, आपको drip भी लगेगी, wound drain भी होगा, catheter भी होगा, दर्द की दवाइयाँ भी देंगे, एंटीबायोटिक भी देंगे, मोबिलाइजेशन थोड़ी डिफिकल्ट होगी, जिसके लिए आपको फिजियोथेरेपी भी करनी पड़ेगी और सब वजाइनल ब्लीडिंग भी होगी. यू हैव टू काउंसिल ऑल दिस, राइट? Am I clear, Rima?
Yes, ma'am.
Okay. Coming to the next scenario, are you ready for the next scenario?
Yes, ma'am.
Next is Mrs. B is 30-year-old advocate with a 6-year history of worsening pelvic pain, dysmenorrhea, and dyspareunia. She has been advocate for diagnostic laparoscopy. ठीक है, अब हिस्ट्री से तो क्लियर लग रहा है कि इसको एंडोमेट्रोसिस होगा. 28 साल की है, वर्किंग वुमन है, पेल्विक पेन है 6 साल से, डिस्मेनोरिया, डिस्परूनिया है. अब उसकी डायग्नोस्टिक लेप्रोस्कोपी करनी है. व्हाट इश्यूज वुड यू चेक एंड डिस्कस विद हर ऑन योर प्री ऑपरेटिव वार्ड राउंड? क्या डिस्कस करना है उसके साथ, मरीज के साथ क्या चेक करना है और क्या डिस्कस करना है इसके साथ?
Ma'am, I will check. I will look for the. First of all, I will introduce myself to the patient, and then I will check her last menstrual period. If she's in a reproductive age group, I will rule out the pregnancy before going for the procedure, and then I will see for which symptom. Then I will I will confirm the procedure. I will confirm the procedure, and I will confirm the consent. A well-informed written consent is taken, and I will look for all the investigation, and then the anesthetic fitness. because this procedure is going to be done in general anesthesia, and I will discuss about the procedure with my patient, the whole the procedure, the complication and risk, and I will address all the concerns the patient have. I will ask for the any drug allergy and previous surgical history, any comorbidities like the diabetes, hypertension, asthma, any other thing, and I will. I will ask about the. I will make sure. I will ask about the blood group, and I will make sure that the cross match has been done in the case of any bleeding. It is a less likely transfer in this case, but anytime you need. And madam, um, I will look for the BMI of the patient, and ma'am, that's all, I guess.
Okay, that's good, Rima. So keep in your mind the consent form.
Yes, ma'am. I will fill the
ये
consent. And
क्या क्या
patient is
देख
not right.
लेप्रोस्कोपी की मैंने कंसेंट पढ़ाई हुई है ना, मैंने उससे
Yes.
पूछना था कि आपको पेशेंट इन्फॉर्मेशन लीफलेट दिया है, आपको ये क्यों दिया है, और चेक हर सिम्टम्स वेदर स्टिल शी इज द सेम सिम्टम्स टू वारंट फॉर द इन्वेस्टिगेशन, और इसके सिम्टम्स कम हो गए, सिम्टम्स को पहले चेक करें वेदर शी इज सीवियर sufficiently severe symptoms to warrant her for invasive investigation. If she says yes, I'm gonna say problem. So describe the procedure, ask for patient information leaflet, check the consent form, check her last date of menstrual, do her examination, simple examination, her BMI, blood pressure, and check her pregnancy test. ठीक है, or you have to counsel her if the pregnancy test is positive, the surgery might be postponed. Discuss the risk of procedure, findings, associated procedures, plan for ongoing care, the post-operative क्या care होगी, check for anesthetic review or post-operative problems. ठीक है, so you have, in summary, check symptoms, previous surgeries, any drug allergy, check for patient information leaflet, consent, procedure. So simple. जो लेप्रोस्कोपी की कंसेंट थी ना, वो आप माइंड में रख लें, तो वही सब कुछ चेक करना है, वही सब कुछ उसको बताना है. Okay, the next case number 3. Mrs. C is a 33-year-old nurse who had induced delivery for her first baby 6 months ago. She has been unable to have an intercourse since then because of the pain and tenderness at the site of her episode V scar. She was examined in the gynae clinic 6 weeks ago when the scar was found to be thickened and tender. She's been admitted for refashioning of the perineum under general anesthesia. उसका scar remove करना है, refashioning of perineum, because she has a dyspareunia. So what issues would you discuss with her on your pre-operative ward round?
Ma'am, in this patient, ma'am, patient has the infected wound. Ma'am, ये मुझे थोड़ा सिनेरियो समझ में नहीं आया.
अच्छा, नहीं है रीमा, उसकी 6 महीने पहले वेंट्यूस डिलीवरी हुई है, 6 महीने पहले वैक्यूम डिलीवरी हुई है, अब उसको डिस्परूनिया है, she has been unable to have an intercourse.
Okay,
intercourse is not possible because of the pain and tenderness at her episiotomy scar. ठीक है, अब जब एग्जामिन किया है, 6 हफ्ते पहले इसका एग्जामिनेशन किया था, इसका स्कार जो इसका थिक और टेंडर है, अब वो एडमिट हुई है फॉर रीफेशनिंग ऑफ पेरिनियम अंडर जनरल एनेस्थीसिया. कल इसको ओटी लिस्ट पे रखा है फॉर रिमूवल ऑफ द स्कार और रीफेशनिंग ऑफ पेरिनियम.
Yes, ma'am. Then first of all, in this patient, I will counsel the patient. I will introduce myself to the patient, and then I will look for. I will confirm the procedure, and then I will look for the consent, and the well-informed consent has been taken or not, and then anesthetic review, and it is either perform. It is going to perform the local or the regional anesthesia, and then I will look for the.
रीमा,
Yes, ma'am.
यहाँ क्लियर लिखा हुआ है कि अंडर जर्नल एनेस्थीसिया, व्हाई यू आर गोइंग फॉर लोकल?
Sorry, ma'am. Sorry, ma'am. Yes, ma'am. Anesthetic. I will look for the anesthetic review and fitness of the patient. I will look for the certain investigations, and then I will tell the procedure and to the patient, and the procedure risk, complication, and the certain post-operative care to the patient. And I will address the any concern if the patient have any. And then I will ask about her future fertilities and future fertilities, and either her and then, madam, I will any
Why,
drug. I will look for any drug allergy.
why you are going for future fertility?
Ma'am, future delivery.
Future delivery, okay. Okay, fine. Anything else you want to eat?
Madam.
देखो रीमा, आपने पहले पहले केस देखना है कि केस क्या है, वो डिस्परूनिया की वजह से आई है।
Yes, ma'am.
पहले उसका वेंट्यूज हुआ था और एपी हुई थी। इंस्ट्रूमेंटल डिलीवरी में एपी तो होती है ना।
Yes, ma'am.
और टेंडर स्कार है जिसकी वजह से उसका क्वाइटस इज नॉट पॉसिबल। तो इसको एडमिट किया है हमने फॉर रीफेशनिंग ऑफ पेरिनियम अंडर जर्नल एनेस्थीसिया। यहाँ पे क्लियर लिखा हुआ है जर्नल एनेस्थीसिया, तो यू हैवंट गो फॉर द लोकल एनेस्थीसिया। अब उसके साथ क्या डिस्कस करना है कि आपने non-invasive methods for perineal relaxations. Check that she has tried all appropriate non-invasive method. हो सकता है कि इसने ये ट्राई नहीं किया हो।
Okay.
You have to check that. Ask her pelvic floor muscle exercise, use of lubricant, use of trainers, use of estrogen cream, use of psychosexual counseling. You confirm her whether she tried all these appropriate non-invasive methods. पहले तो नॉन इन्वेसिव करते हैं ना, अगर उसने ये किए ही नहीं है तो why we are going for this? So you have to check these and explain her whether she received the patient information leaflet, whether she knows about the procedure, and explain that the excision of the scar and resuturing will create a new scar. A new scar might be bed scar. Sutures are usually resolvable, but healing will take at least 2 weeks or more. So do not attempt intercourse until new scar has healed. Cannot guarantee that new scar will be better than existing scar. तो न्यू स्कार मोर खराब हो सकता है कि मोर अगली और मोर थिकेंड हो सकता है एज कंपेयर टू द प्रीवियस स्कार। उसको कोई गारंटी नहीं है। यू हैव टू डिस्कस विद दिस पेशेंट। चेक पॉसिबिलिटी ऑफ द अर्ली प्रेगनेंसी। ठीक है। चेक हर प्लान्स फॉर कंट्रासेप्शन व्हेन इंटरकोर्स रिज्यूम। उसको कंट्रासेप्शन चाहिए नहीं चाहिए। आस्क इफ शी इज स्टिल ब्रेस्ट फीडिंग अ बेबी। सो डिस्कस रेलिवेंट प्रैक्टिकल चीज। एस्ट्रोजन अगर वो ब्रेस्ट फीड कर रही है तो हो सकता है उसको एस्ट्रोजन डेफिशिएंसी की वजह से डिस्परूनिया होती हो ना। Ask her to sign the consent form. सारा consent form का चेक करना है कि whether she knows about the risk, alternative risk, post-operative care, anesthesia, or anesthesia review has been done. Clear?
Okay, ma'am.
ये सब कुछ आपने इसको वार्ड राउंड में बताना है। यू हैव टू डिस्कस इट अलॉन्ग विद कंसेंट फॉर्म कि कंसेंट ली हुई है, वो आपने चेक करनी है। पेशेंट इंफॉर्मेशन लीफलेट उसने पढ़ा हुआ है नहीं पढ़ा हुआ है, एनेस्थेटिक रिव्यू हुआ है नहीं हुआ है, इसने प्रीवियसली कोई नॉन इन्वेसिव मेथड ऑफ पेरिनियल रिलैक्सेशन ट्राई किए हैं नहीं किए। एक्सप्लेन करना है कि एक्सिशन ऑफ स्कार करेंगे, रीसुचरिंग होगी, दोबारा से स्कार बन सकता है, वो दोबारा वाला न्यू स्कार में बी नॉट बेटर स्कार देन प्रीवियस। और जब तक हीलिंग होगी, हीलिंग में डिसॉल्वेबल यूट्रस सुचर्स यूज होंगे और these sutures are dissolvable in 2 weeks. It will take more. So till the healing is occur, you have to avoid the coitus. ठीक है, ये हर केस में आपने ऐसे ही करना है, मगर रिलेटेड टू दैट केस टेम्पलेट सेम होगा, मगर उसका कंटेंट जो होगा वो रिलेटेड टू द केस होगा. So these are the general points for theater list stations. कोई भी theater list station आए, कोई भी केस आए, तो आपको important point क्या क्या चेक करनी है. Information gathering, review the notes, see the indications of the surgery, previous surgery, medical history, still symptoms are there, a lost menstrual period, smears up to date, what is her BMI, very slim is also dangerous, aorta vessels damage hogi, very obese is also dangerous. So communication with the patient, check her understanding about the procedure, is the patient information leaflet given, any concerns, any queries. Communication with your colleague, clear, coherent approach in explaining steps, other specialties is required if she has any medical comorbidity. Patient safety, check the consent, risk, and alternative should be explained. Her medical condition should be optimized. Current medication should be stopped. If she has any drug allergy, preoperative investigations, pregnancy test performed. If she is in the childbearing age, ऐसे नहीं menopausal है फिर आप pregnancy test कर लो. Postpone the procedure if suspected pregnancy or on blood thinning agents. So applied knowledge, ask for specific points for a specific case. Family complete है तो hysterectomy का discuss कर लेंगे. Results of previous biopsy, if hysterectomy for HMV. Family history of cancers to counsel about removal or leaving the ovaries. Need to examine her in case of hysterectomy to decide the mode of and route of the hysterectomy in case of the fibroid or planned abdominal incisions. तो fenestrel देंगे, midline देंगे. Post-operative plan including thromboprophylaxis and antibiotic prophylaxis. So you have to keep all these points in your post-operative or pre-operative theater list. So this is the information gathering, communication with patient, communication with your colleague, and patient safety and applied clinical knowledge. Any question?
मैम इसमें जो हिस्ट्री पॉइंट्स हम पूछ रहे हैं, जैसे आपने बताया कि प्रीवियस पेशेंट ने कोई अल्टरनेटिव लिए हैं, दिस इज इंक्लूडेड इन हिस्ट्री, उसके बाद ये पेशेंट एडमिट होगी और फिर में हम इसको जो है ना सर्जरी प्लान करेंगे, तो हमें जो है ना प्री ऑपरेटिव राउंड में भी ये हिस्ट्री पूछनी है, वहाँ पे तो हम बस प्रोसीजर कंफर्म करके
ज्यादा डिटेल नहीं पूछनी है, एलएमपी पूछनी है, ड्रग हिस्ट्री पूछनी है, कोई दवाई तो नहीं ले रही है, क्योंकि कभी कभी ये मिस हो जाती है पॉइंट्स. यू हैव टू रीअसेस इन द वार्ड, माइट भी पेशेंट को पोस्टपोन करना पड़े हमें.
ओके मैम.
रीअसेस इन द वार्ड.
ये इसके कंसर्न हो सकते हैं ना कि अब मैं सर्जरी करवा रही हूँ तो फिर क्या होगा, फिर से तो नहीं होगा, तो उसको कंसर्न्स को एड्रेस करना है ना.
यू हैव टू एड्रेस हर कंसर्न्स टू, क्योंकि वो उसके एड्रेस कंसर्न्स तो कंसेंट में हो गए ना.
yes,
जब उसको हमने काउंसिल किए फॉर द एडमिशन, उसकी कंसेंट भी हुई है, कंसेंट ली गई है ना. यू हैव टू रीअसेस योर पेशेंट इन प्री ऑपरेटिव वार्ड राउंड. जो ओटी लिस्ट पे पेशेंट रखे गए ना, उनके भी डिसीजन चेंज हो सकते हैं. प्रेगनेंसी टेस्ट पॉजिटिव आ गई है तो आपने पोस्टपोन कर लिया ना. अगर अब मोड ऑफ और रूट ऑफ सर्जरी आपने वहां पे असेस कर लेना है, उसने पहले कोई ट्रीटमेंट ली भी है या नहीं ली है, वेदर स्टिल शी इज द सेम सिम्टम्स. क्योंकि ओटी लिस्ट के लिए जब पेशेंट एडमिट होता है तो वो 2-2 हफ्ते तो वार्ड में रह लेता है. 2 हफ्ते में पता नहीं क्या कुछ हो जाता है मरीज को. ऐसे थोड़ी है कि आज एडमिट हुआ है कल उसको लिस्ट पे रख लिया, ऐसे तो नहीं होता है ना कहीं पे भी. सो योर पेशेंट इन द वार्ड सम टाइम, महीनों महीनों लग जाते हैं मरीज को लिस्ट पे. एक लंबी थिएटर लिस्ट होती है, एक बिजी थिएटर है, एक बिजी वार्ड है. So you have to reassess all these. Any question?
Okay, ma'am. Thank you.
Ma'am, is there any information of the liver long cases again?
Dear, I don't know. I don't have such information. Many girls are asking from me, but I don't have such information. क्योंकि ये information अगर होती